if you're seeing patients who have eyes, then at some point those eyes are going to have issues, And optometry, there are many more optometrists than ophthalmologists nationally. So in terms of the volume of patients being seen, it's optometry is seeing more patients on a daily basis in the office than ophthalmology is. But in terms of why optometry should be looking at amniotic membrane as a treatment to add to the arsenal in the office in the primary care setting, well, cost of goods is low. Okay. Most insurance plans cover it, right? Reimbursement is very healthy. You're looking at several times your cost of goods in reimbursement. So it's there's that's already kind of off the table. It's safe. Results are quick, and if in most cases for me 3 to 7 days we're seeing a turnaround of whatever we were treating. It's very quick to do. If you've never seen it done, I would say go to the Ophthalogix website, see it done, and even there we're slowing it down because we're talking you through it. It's really very, very quick, somewhere between 30 and 60 seconds. It shouldn't take more than that. I'm sure many of us waste 30 to 60 seconds during an encounter with a patient anyway, so we can easily just reallocate that time to placing an amniotic membrane on. In terms of things to be aware, to be careful of, there's an unknown there. There's a gap in knowledge, a gap in education there for a lot of folks. Not everyone was taught this in school, and we're always, as far as what we're taught, we're a little bit limited by who we learned from and what they taught us. People oftentimes will teach you what they know well. They'll teach you what is within their experience and their comfort zone, things that they've done, things that they haven't done. They might touch on the topic, but not really get into it because questions are going to come back that they can't answer because they haven't really done it, So there's a lot of reasons that people haven't learned this topic properly. Ophthalogix has become a good resource for knowledge in this area, for ODs to learn a bit about the different indications of amniotic membrane. There's a lot of disease state education that's put out by the company as well. There's a lot of procedural information and best practice guidelines that are available on the website too. And what's really good about Ophthalogix as well is that for ODs who do have questions, even if they're not clients or customers, you never purchased a graph, you just have questions, you can call the company and they'll arrange a phone call at no charge to the OD. With a clinician who's knowledgeable and experienced in that space.